Hello, Dr. Lynn, HFHill. We talked today on the phone, and I'm going to take you through the Spinalight Elevation all auto cocking drop table. Okay, so first of all, at its lowest, it is 21.5 inches. 20. Right? 21. It's 21. Sorry, I did say 20. Okay, so here's our elevation foot pedal. It's got one of those whisper quiet Swedish motors on it, and it's got a 6-foot cord to it, so you can put that anywhere you want, and it's going to go up to 28. Okay, because you do have elevation on it, you're going to get your Section 44 50% tax credit on it. Okay, so starting at the headpiece, got our tension for our drops. If we lift on this, you got a tilt to it. So you just simply lift on it and the gas shock does the work there. We've got a paper attachment, paper guide, and paper cutter. Okay, we'll use all those in just a moment. And it's got some rotation to it. Okay, if we loosen that up, we've got some left and right rotation to it. It's not a feature too many people want, so I pretty much lock it in place because it works great as a standard headpiece like that. Okay, we have an upper thoracic, lower thoracic, and pelvic drop with a little gonadal notch in there. We've got tension knobs for all three, and we've got on our auto cocking, you choose which drops you want to cock up, and they come up. Okay, we have a slide out ankle. Okay, for shorter patients who want to put their feet in like that, you would get that, and certainly for taller patients, you can stretch it out there. You got a cocking strip on this side, and a cocking strip on this side. Okay? And you also have a regulator up front. This is a regulator that's adjustable, and we've been playing with it here for the cervical because the upper thoracic, lower thoracic, and pelvic can be a bit aggressive when they cock up, but you can control the cervical with that little valve regulator. Okay? So I want to take you through, I'm going to show you compressors in just a minute, but I want to take you through right here, Bryce. So we are set at, what does it say there? That says 42 pounds. Okay? So our next patient comes in, and Doug Jenkins. Doug Jenkins is 280 pounds, and I know from practicing with this that we have to turn up the regulator and get some more pressure in it. So Bryce, I lift on it right here and turn it and close the cap. Okay, so it's that simple. Mr. Jenkins, if you would, I want to put some paper in here. Paper cutter, come down here. Okay. Okay. Doug carries a lot of weight in the middle, and that's absolutely for auto cocking the most difficult thing to do. We're going to do the lower thoracic lumbar, they call it, and pelvic. Cock those two up. So we need some more tension on this one. The pelvic came up just fine. A little more tension here. Okay, so we hold there and we hold there, and we still have plenty more room to go. Okay, so but that's all we need there. Do that one again. We'll do the upper thoracic. Need a little more tension on that one. Okay, almost there. Okay, so 3. Okay, those are our 3 drops there, and we talked about the cervical being, it's slower because of our regulator. Oh, sorry, I should put more tension on there. Okay, so there's our cervical drop right there. So our tension knob for the cervical, the regulator so we don't have a quick pop up. Okay? All right, Mr. Jenkins, thank you for your efforts here. Our next patient is Pam, so we go from 280 to 110. This is a very big swing, and what we don't want is that aggressive pop up and drop. Put your paper here, face up here, sir. Okay. All right, so we're going to go over to our regulator, lift on it. I'm going to dial it down. Whoops, go the other way. There we go. Right there. Okay, so it goes down. We're going to come over here. And again, we're going to start off with the lumbar pelvic right here. Go there. Nope, not enough pressure. Okay, come back over here. There we go. So we got drop there. We had it way up for Mr. Jenkins. Drop it down. All right. And let's do the pelvic. The pelvic. Let's go to here. Go the wrong way. There we go. There we go. So we got our pelvic, lumbar,
well, it's not windy yet, is it?
thoracic, and cervical. So right there. Got all that pressure on it from Mr. Jenkins. Back it off. Okay, so we're going to try that again. There we go. And the cervical is up. And there's our regulator built in. Okay, so let's see. Oh, we lift on that. We want to put a little tilt in there for the cervical. We have that. Okay. All right, Miss Pam, thank you very much. Okay, back to our compressors. I want to turn on, as I said to you, I had a free compressor, and I want to show you the free compressor, and I'm going to show you an upgraded compressor. Okay, this is our free compressor. It works just fine. It's got the regulator right here on it, but it's loud. Okay, so it fills the tank, and these type of compressors typically are put in rooms not near the table, and you run a cord to them. The challenge with your situation is that you need a regulator nearby because of the table and the style of the table. So this is a $1,400 silent air compressor, and it's a used one, and we sell those for $800. We just put a new regulator on it, and if you want the still air compressor, $200 is going to cover my buying of it and updating it with the brand new regulator. So that's our video. From here, you'll be able to look and judge and ask any questions you like. There are a couple things that I noticed about the table. The armrests, I believe, are too low as we laid on it. So what I want to do is I'm going to bring them up some and bring them down some. I'm going to build up underneath them with a 2x4. I'm going to paint it black so it matches the trim. We're going to do that anyway. If you're still interested in the table after this, I'll certainly show you what that looks like. And the headpieces, where we talked about the paper guide rod here. Does a great job, but I want to bring these cushions a tiny bit closer together and maybe elevate those a little bit too for anybody with a big schnoz. So that's my video. I'll upload it and can ask you questions tomorrow. Thank you.